Thank you, Chrissy. I want to thank everyone that's here. Really appreciate you coming out. I want to thank members of the press. We have some elected officials, decision makers. We have those working in the prevention space, researchers from multiple different universities. We have those working on treatment and recovery, and also concerned parents who are living the reality of this issue every single day. We're very excited to, obviously I'm very excited about my book, One Nation Under the Influence, but that's not why you're here. We're not here to talk about that, although you can enjoy your copy. We're really here to release two major projects that we at SAM have been working on, and I want to thank the staff of Smart Approaches to Marijuana. Many of you know SAM was founded in 2013 with David Frum, myself, and former Congressman Patrick Kennedy. To really chart a new path forward in marijuana policy and to hold the marijuana industry accountable. As you know, we are walking as a country, and we have been walking blindly towards repeating the same mistakes of the past that we've made with the pharmaceutical industry, that we've made with the tobacco and alcohol industries, creating the commercialization of a multi-billion-dollar industry whose business it is to increase addiction and regular use in this country. And now, as we see the impacts in various states, we see that that has absolutely been true. And so we come today to release our two things. First, our new data report, Legal Marijuana in New York State, Promises, Reality, and the Path Forward. And to be honest with you, I wish we didn't have to release this report. Frankly, we shouldn't have to do this. This is the job of really a taxpayer-funded government that is implementing and advocating for the marijuana industry on a seemingly daily basis. We would hope they would also be keeping score for public health. They call this an experiment, but it's the only experiment I know of where we're actually not really interested in the data, and we're not interested in making changes to improve public health and safety. Experiments are not always a good thing, as the late NYU Professor Mark Kleiman used to say. Frankenstein had an experiment too. It didn't go well. And the reality is right now, we are dealing with a multi-billion-dollar industry that's getting stronger and stronger every day and getting promoted by our tax dollars. And when we think about the perverse incentive of thinking that we can get revenue from something and pay for the problems with that revenue, that would be like, letting people who paid $1,000 drive 150 miles per hour on the freeway and using that money for them to drive fast to build a hospital wing for the crash victims. It makes absolutely no sense. And what we're dealing with today is something far greater than I think most baby boomers and many of those who put the policy into place really can imagine. So we're also here to announce our new advertising campaign, which is also something we should not be having to do as a small organization with a staff of fewer than 15 people. This is something that we also would think government would be doing to at least clean up the mess and raise awareness to prevent some of the tragedy that you're going to hear about. But we have really seen nothing other than make sure you get your marijuana from a licensed store and do it with other people around. That's really the only message we've been hearing from New York officials, and it really makes absolutely no sense. So, it was this policy of legalization in New York was really sold to the people of New York as a safe, healthy, and crime-reducing policy. And what we found is that it's really failing the public in several key areas. I'm going to go over some of those areas today. Of course, we're dealing with something that is a completely different drug than what 80% of the lawmakers who voted for this, including the governor at the time, who I think was distracting from other problems and ended up signing the bill, can appreciate. And that's the fact that we're dealing with a completely genetically altered, modified, genetically bred plant that is very different than what it was in the 1960s and 70s. So we're now dealing with concentrate potency that's legal in the state that can be up to 99% strong. And when we're dealing with that, we're going to be having, a lot of negative impacts, including, in New York City alone, we were told young people would have less access to marijuana if it was legal. That's what New Yorkers were told. And the reality is, even with the sort of very conservative way that this city even tracks drug use, which is kind of arcane. I mean, there's a lot of more work to be done. And frankly, I think the researchers who did a lot of this would have wanted more resources to do that. But with the resources that they had, which were very little, this was reporting schools that report to the CDC's Youth Risk Behavior Survey. We know that current use has gone up by about 10%. total. That's 1.3% percentage points. And then those that are trying before age 13 in the city has also gone up since legalization. We're going to get the new data very soon. We don't have it yet, but right now it's just not going in the right direction. We've seen marijuana-related emergency room department visits increasing by 131%. Poison control cases in our state way up, really, especially among very young children who are accidentally getting edibles. And we've seen use by pregnant women and other vulnerable populations go up. And this is extremely concerning, given the fact that today's marijuana is causing psychosis, is causing leading to reductions in IQ and learning problems, other brain structural changes, etc. One of the main arguments that I think more of the well-intentioned people who advocated for legalization, because not everybody was going to be able to, of course, get a license and be part of the multi-billion-dollar industry. In fact, those that are part of this industry, of course, look a lot like me than the people that they were promised to serve. Let's be very clear about who's making money from this industry. It is not, rising up new millionaires in Harlem or Hamilton Heights, Washington Heights. It's instead, frankly, funding a lot of people who live in Tribeca, Soho, and in the financial district. The reality is, despite representing about a fifth of the state's population, Black New Yorkers represent about 40% of the treatment admissions. So when you look at the increases of what's happening, we're seeing this fall in vulnerable populations the most. There's been some great research by folks at NYU and Columbia on what's happening at NYCHA housing, the fact that kids are reporting in NYCHA housing much more of secondhand exposure to today's toxic levels of marijuana, which, by the way, has more carcinogens than tobacco now. And they're reporting that more than they ever have. It's increased since legalization. The other promise we were told, other than social justice, which clearly hasn't happened, is that we would be able to get rid of the drug dealers. We were told that the underground market for marijuana would go away. Instead, anybody who walks around in New York, and those of us who are New Yorkers, know that that has not happened at all. First of all, delivery services and the underground market are thriving more than they ever have. And the illegal stores, the illegal storefronts are thriving as well. Just about a year and a half ago, the city council estimated 8,000 what they called illegal stores versus the licensed stores at that time. I think everyone can come together, even those who advocate for legalization, realize we need to do an even better job at enforcement of the illegal stores. At the very least, that would at least reduce the number of places that young people are obtaining and other people who have a problem and mental illness are obtaining today's high-potency marijuana. The other thing we were promised is at the very least, we would see some tax revenue. And the reality is marijuana taxes in the last fiscal quarter that we can find, Q4 2024, accounted for about 0.15% of the total revenue in New York. And when you look at what it's projected for even this year, which is a year that they would say is the most successful year, it's going to be 0.21%. And you compare that to what was promised. We were promised annual tax revenue of $1.3 billion, and we got 16 million last year, or 2 years ago, and last year 80 million. We're nowhere near the promises of where we were supposed to be. And this is, again, worrisome because of these are studies that just came out in the last 6 months. Every month we're seeing new research and new studies about the health effects of marijuana, the very strong association, for example, of heart attack now, diabetes, and I mentioned before the long-standing association with schizophrenia, psychosis, and other mental illness. So we have a big problem on our hands, and it's something that, our leaders are not wanting to confront because they think, well, this is just popular. Everybody wants this. The reality is when you do surveys, and we're going to hear from somebody in a minute, Dr. Linda Richter, who's going to talk about some of those surveys. We know that New Yorkers, even those who voted in favor or wanted, there was no vote, who were in favor in a poll for legalization, they want to see safeguards. They want to see this not be so out of control. And I can tell you, talking to some of and I won't name names, but some of the campaign staff of some of the front runners of the people who just won for our city elections, a lot of those policy staff privately are extremely concerned with what's happening with marijuana. They don't think it's been going well. They're not ready to say it out loud yet because they don't feel like they can, which is also, I think, problematic. It's probably what people thought about cigarettes and tobacco in 1975. They couldn't say the quiet part out loud. We're kind of at that point right now, I think, for marijuana. But I do think that the more that we get the science out, that we hear about what's happening, I do think the more of the negative impacts we're going to have. So what can we do? What do we call for in the report? Some very basic things, that the things that we would ask for any kind of product that is at least this dangerous, or even half of as dangerous, I should say, we want. We should have warning labels. There are a lot of adults who do not realize that this is not the Woodstock weed that they used to use. We should consider, because brains are developing until at least 25, raising the minimum age for 25. You know, when we raised the minimum age for drinking in this country, we reduced car crashes in this country and saved hundreds of thousands of lives. That's a proven fact. And so when you do increase the age, when you make it less available, it does help. Does it get rid of it? No. Does it mean young people can't obtain it? No, of course not. But it makes them less likely. We also, at the very least, let's get up to the standard of where alcohol is and the standards of restrictions, which is not anything to, by the way, be so super excited about. But it's a huge benefit and would be a big leap from where we are now. Let's use the state restrictions on alcohol marketing as a guide to create guardrails around marijuana advertisements. Taxes for marijuana sales and retailers should be spent on prevention and treatment. We're going to hear from somebody that's going to talk a little bit about what that would mean. We should be prohibiting internet sales and delivery, which absolutely have zero safeguards. There needs to be more enforcement. And frankly, we should be restricting edibles and concentrates, which are getting into the wrong hands as much as possible. So these are very important. You can scan to download the entire New York Impact Report. It's available right now on our website for anybody who wants it. I'll give you a minute to do that. And I should just say it's an honor to stand here with, not only with the great panelists you're going to hear from, but, with our friends at the partnership who were using their space today to release our report. The long history of the work, of course, that they've had in advertising on this issue, but also with their merger with CASA, the Center for Addiction and Substance Abuse at Columbia University, founded by Joe Califano, the multiple research reports and standing from these very lecterns talking about these issues for the last 30 years. We're very proud to stand with them. The second thing I want to quickly get through is our new ad campaign that we're calling What is Marijuana? This is an ad awareness campaign to educate New Yorkers about the harms of marijuana, particularly the highly potent THC products that are being sold right now. What we found when we talked to New Yorkers and polled them is that there is just widespread misinformation and disinformation, just very low awareness about the potential harm. So we're kind of going very straightforward. We see these going up near subways. We see these going up on the street. We're completing the ad buy, finalizing that now. We're going to be doing a digital ad buy on this as well. But again, this is not something that a small organization like us that relies on individual donations should be doing, to be honest. We really hope this kind of wakes up our regulators and our decision makers, our elected officials who know that this is out of hand. You cannot be alive in New York after 2024 and not realize how out of hand it has gotten, from the secondhand exposure, frankly, from the third-hand exposure, from the increased hospitalizations, et cetera. So we need to raise awareness. And we found some of the points that are very clear in the science, but are very unclear in the public sort of cultural awareness about, for example, how strong marijuana is today, the link with psychosis, schizophrenia, depression, and even suicide, the link with workplace accidents, the issue we're having in our country right now with unemployment, with everything else that's going on. The idea that we want to be encouraging an intoxicant makes absolutely no sense. The crime that we're seeing that's linked to this, and there's all different kinds of ways and different nexuses that crime is related. Touted as all natural by this industry, what we're seeing with heart disease, lung cancer, and stroke, et cetera. So we are very excited about these ads, the advertisements. You can actually see them. You can go on our website, learn about sam.org, and you can put in the /2025/11 and then marijuana-ads to get them. You can scan this QR code. We're going to be making these on a limited available basis for people outside of New York as well, to be able to use this. Right now, we also know that some of our colleagues are working on some legal action in New York State because there's such a lack of really understanding about the liability harms that are going on. There's a lack of understanding about insurance. There's a lack of understanding from regulators about what they're even regulating. And the state really, right now, until they get their act together on this, doesn't really have business selling these toxic products. So we think this is a multifaceted approach to raise awareness with, again, legal awareness, with advertising awareness, and then with data and research. I see my staff has put in a slide about my book, but that's not what today is about. You can order a copy if you want, but for those people that are here, it is for free. But actually, it's relevant because in the book, we talk about addiction for profit and the addiction industrial complex that, whether it's psychedelics today, marijuana yesterday, heroin tomorrow, there are people, especially in this city, especially right around here and downtown, that stand to make a lot of money off of other people's misery. And we need to really have the discussion, a proper discussion, not saying that we want to incarcerate, not saying that we want to arrest, not saying that we want to increase racial inequity, but why would we have to have a false dichotomy between mass arrests and enforcement and mass commercialization and the harms that come from that? That is a false dichotomy. And we need to really wrap our heads around that because we do not have the resources as a city or state to deal with the fallout.